So today we're going to hear about routine applications, what's called routine. Everyone knows that there's not so much routine about routine. So we'll be talking obviously about food analysis and the clinical applications of mass spectrometry. And the thing we're going to talk to you about today is a completely new product called the Q Exactive Focus. It's an instrument that's been developed with routine applications in mind in terms of the performance being exceptional for the price point. So we've obviously thought about the pricing as well when we've developed this system for you. So we're going to have a little change to the session because of organizational errors from Thermo and not from anyone else. And the first talk will be from Olaf Scheibner, and he'll be talking to you about food and clinical applications. And we're going to invite Bertrand Rochat to stand up, who's had early access to the Q Exactive Focus. He'll stand up and he'll talk to you. He doesn't have slides. Again, that's our fault. He's going to come up and talk to you about his experience just for 1 or 2 minutes on the Q Exactive Focus. The very last slide is basically a 3D barcode. If anyone has those applications on their phone, you can scan that now. It seems to work from even far back. And then you can get access to information very early on by signing up to this sort of mailing list. So our first speaker, Olaf, will come and hopefully engage you, interest you, excite you about the Q Exactive Focus applied, a high-resolution accurate mass system in the routine markets. Thank you.
Thank you, Martin. So what I want to show to you is what the newly introduced Q Exactive Focus is and which applications we can run on that system with which results. Some of you maybe have seen Marche's introduction yesterday already. Here we will go about a couple of things a little bit more in detail and show applications of that system. The Q Exactive Focus is based on the known Q Exactive platform with the 3 instruments we have so far, Q Exactive, Q Exactive Plus, and Q Exactive HF, which always are development in new options we have in technology, so always stepping up with new features. But of course, these systems have a certain price point. So in this case, we were more focused on the question to create an instrument which is capable of all the work small molecule routine analysis has to do, but on the other hand, address the price point, which is clearly a different one than on a high-level research labs with different fundings, of course. And that's the result which we came up with. So we have a Q Exactive instrument, so a Quadrupole-Orbitrap hybrid with a maximum resolution of 70,000 m/z, full width at half maximum. We have a mass range up to 2,000 m/z. We have the mass accuracy known from Q Exactive instruments, so that's less than 1 ppm with internal calibration, less than 3 ppm with external calibration. We have fast polarity switching, so 1 full cycle, 1 positive spectrum switching, 1 negative switching, spectrum and switching back inside less than 1 second on 35,000 resolution. We have, for data-dependent analysis, a maximum of top 2, and we introduced with this system absolute collision energy because this fits better for small molecule applications. If you maybe used the Q Exactive systems already, you know that on these systems you have normalized collision energy. That works very nicely for peptide and protein work, where the rather easy equation, smaller mass, smaller collision energy, works very well. But we all know that for small molecules, we, in enough cases, have the exact opposite. So that didn't fit, so we switched over to absolute collision energy on that system. So in that Q Exactive Focus, we have the known Orbitrap detection. We have the known quadrupole with hyperbolic rods. We have the RF lens ion optics for great robustness. And we have the known HRD fragmentation, very robust, giving very fragment-rich spectra for an unambiguous identification of compounds. This is the schematics of the system. You have the ion source and ion optics here with the RF lens. We have the quadrupole for precursor ion selection, the C-trap, the Orbitrap, and in the back, the HZ cell. That's the known layout of all Q Exactive instruments. So, what can we do with this instrument? One example for high resolution and the need of high resolution. In this case, of course, it is made up just to keep things under control. We have two components being very close together. And you see with 17,000 resolution, you are not there. You get a completely wrong mass. On 35,000 resolution, we get a sort of separation, but this is definitely not yet suitable for routine application. Just a little slip in there, and you again don't see that flank here. And with 70,000 resolution, we clearly can separate these two components. As I said, it's made up. Of course, it's an example, but look into the data of high-res instruments. You will see that often enough. It's not necessarily two components you want to look at, but you have often enough matrix ions being just as close, which would completely destroy your analysis when they're inside here, and especially if you're looking into detection at the limit of detection, these matrix signals often are bigger than the component you want to look at, and you get a completely wrong quantitation, even if you can detect it. We ran the system for 5 days, injecting wheat matrix with a couple of components. I took one out of here. This is aflatoxin G2. And we are looking into the stability of the peak area integrated with our processing software. And on the other hand, looking at the mass accuracy over the whole time of 900 injections during more or less 5 days. And you see that the variation of the peak intensity is rather small. We get a flat line here, so we don't get any decrease due to contamination. And on the other hand, for the mass accuracy, we still stay inside 1 ppm plus minus 1 ppm window with internal calibration. So the RMS value is 0.45 ppm of the whole time. And we have on the intensity an RSD of nearly 12%. So you can get additional warranty on that system. That's just a side mark here, that it can be easily purchased with a long time warranty to give you more security that the system will do the work it's intended to in your lab. We have new instrument control software on that system. Just a side mark, it's called 2.5. That's not that important. It's software which is valid for all Q Exactive instrumentation, but it's specifically for the Q Exactive Focus that's added in here. So the scan modes we have. So we cleaned up the instrument software a little bit for Q Exactive Focus for more easy operation. So basically what you will find in the end, in the method setup, that you find full scan, you will find SIM, you will find PRM, which is a targeted MS2 mode, and you will find full scan AIF and full scan VDIA. This already directs you into the direction that on such a system, the major application is running everything in full scan and using the MS2 data mainly for confirmation. But the main detection is done in full scan. So that's a sort of a shift of paradigm if you come from triple quad, that you don't think in fragmentation anymore, you detect in full scan. And of course, the resolution in full scan is the prerequisite for that you can unambiguously detect your components. And in full scan, we have two options of confirmation. One would be full scan confirmation, which is the classical data-dependent MS2. You have an inclusion list. The system is looking for specific masses that can be 10, that can be 2,000, no matter what. And whenever such a mass comes up, it will trigger one MS2 spectrum, so you have the fragment ions for your confirmation. Or you'll run full scan discovery, which is a top-end experiment. So the most abundant ions will be taken, fragmented, going onto an exclusion list, and you will take the next one. The difference is, of course, you don't get that deep into your components. So the low-level components you will not detect most likely with such a scan mode that's more for metabolite ID than for quantitation. We have the SIM mode with up to 10 times more sensitivity for specific detection of a lower number of components if sensitivity in full scan should not be enough. PRM going the same way with added selectivity. Full scan AIF, that's known from all exactive instruments so far. You have the full scan and the fragmentation of all ions together. And we have the VDIA mode. And on that, I want to leverage a little bit more. So VDIA is data-independent acquisition for a full digital record of your acquired data. VDIA stands for Variable Data Independent Acquisition. Data-independent acquisition is known from proteomics, where you try to mimic sort of the data-dependent MS2 in an unbiased manner. In this case here, for the small molecules, it's more the other way around. We come from the AIF mode, which lacks sort of selectivity, and by this way sensitivity, slice the AIF windows to get higher selectivity and sensitivity. So you can do up to 8 windows with a minimum isolation width of 50 Dalton. So that's the difference to classical DIA applications. So that's what such a scan setup looks like. So you have, for example, a full scan, which covers the mass range from 100 to 1,000, which is fine for most of small molecule applications. And subsequently, we have in this example 5 windows for fragmentation, 4 of them having an isolation width of 100 Dalton, and the last one at the upper mass range has a wider window, so we don't slice everything the same size, but to save some time, we give the upper mass range a bigger window. So in total, we are here at a full cycle time of roughly 660 milliseconds. So that's basically still fine, even to be compatible with fast chromatography. If you run really ultra fast chromatography with 1 second peaks, you still should think about something else. But even with 5 second peaks, you can work with this very nicely. And I will show you what's the beauty of that. So basically, VDIA fills the gap between data-dependent MS2 acquisition and AIF. Conformational MS2 has still the best selectivity and sensitivity. That's well known. But if you want to do anything beyond your very limited target acquisition, you cannot do very much in this mode because you don't have fragments for components you are not thinking about beforehand. So you could detect them in full scan, but that's it. Discovery MS2, as I already said, very nice selectivity as well, but you don't get to the low abundant ions in most cases. AIF has all the fragments all the time. That's basically what we want. But since we have all the fragments inside, you're lacking sort of selectivity, so confirmation in many cases fails where you need it. So in the end, that's not appropriate for the same, to do quantitation and qualitative work and the same data. And by segmenting the AIF, VDIA enhances the selectivity and dynamic range on this data. So that's an example. If you look into the antibiotic oxacillin and pig kidney, so we get a nice, in AIF mode, we get a very nice extracted ion chromatogram of the parent ion. That's clear, full scan, high resolution, everything's nice. We get a good calibration curve, that's well as well. But here you see, if you look into the fragments, it's an ion overlay of all the fragments available for that. There's nothing specific behind it. So in terms of regulation, this would be a no detect because you cannot confirm. You can see the ion here, but you cannot confirm. In terms of regulation, you cannot say you have detected it. The same sample, the same instrument, the same chromatography, just run directly behind it in VDIA mode. You see again the nice extracted ion chromatogram of the peak. Of course, the calibration curve stays the same, but on the fragments, you see the huge difference here. This is something which you can take for confirmation. Yes, confirmation. There you see at least 3 fragment ions together with the parent ion. You see a nice coelution here. So everything's fine. You can go report that as detected. And by this, selectivity is higher, and by this, the sensitivity is enhanced because you can confirm to lower limits. And as it comes out in the end, if we do a comparison on the same instrument, it compares very well with full-scan data-dependent detection. So the limits of detection are basically the same on both modes. So why use VDIA now if it does the same as full-scan data-dependent MS2? As I said, you can go back and look for other components, even confirm them. So the whole unknown screening with confirmation is possible here. You can go back at every time and look at any component you want to look at, which you didn't have in mind beforehand. To aid us in that, we created a new library specifically for Q Exactive instruments. So we have a library on environmental and food safety, clinical and toxicology monitoring, done on different collision energies. I will show you a couple of numbers in the next slide. So for identification with high confidence, very quickly, for HRAM, high resolution accurate mass screening. So we have the database created at a 140,000 resolution. We have pesticides, mycotoxin, veterinary drugs, environmental contaminants. We have drugs of abuse, therapeutic drugs. We have multiple collision energies, multiple spectra per component. And we populated that with retention times and relative retention times, which are accompanied by ready-made methods you get with the library, so you can see which conditions have been used. If you do it the same way in your lab, you even can use the retention times from the library for identification. So currently we have roughly 1,600 EFS components in there, roughly 1,100 clinical toxicology components. So the whole thing is represented by roughly 13,000 spectra at the moment, so that's the current number. It's still counting. We are, in the end, heading for something like 6,000 components in the latest stage. So we're still working on that, take some time to acquire the spectra and make sure that the quality is fine. So with time, over the next months, we will even increase these numbers. And on the other hand, what we have as an addition is the online repository MZ Cloud, which is free to everybody to look at and to search data in, which at the moment contains 19,000 spectra in EFS, 12,000 spectra for clinical toxicology, and this is still counting. And for the future, this is even a user library, so even users can contribute spectra from their own components, put them there, and use them for subsequent search for their own purpose. Okay, some applications. As I told you, I want to show you what this instrument can do if you treat it under real conditions. So for example, for food environmental, what we see here is vet drug screening, pesticide screening, non-targeted screening, food safety testing, water analysis, just to name a couple of applications we have already run on that instrument. And for one example, we had veterinary drugs in food samples using full-scan VDIA. I don't name all the details here, that would take a little too long, just for reference here. And these are a couple of components, basically the antibiotics used in this study. And you see here the limits of detection, the limits of quantitation are fairly low. They are, in most cases, below 1 ppb, and so they are way lower than the administrative regulations at the moment give us the limits. This is even future safe, so even if the limits get tighter, they will still far away from these detection limits here. We didn't have only antibiotics in there. We had Avermectins and Imidazoles in there as well, just to have a couple of different components which behave quite differently in chromatography and mass spectrometry. But we had all these components in the same samples, ran them on the same chromatographic method with the same instrument method. So everything's generic. You just go, shoot your samples, and get the results. You don't need to optimize anything. The system is not dependent on any component optimization. The chromatographic method has been chosen that way that it should do for the vast majority of all the components you find in environmental and food safety applications and even clinical applications most of the time. And this is one of the methods you will get together with the library on the system when you buy it. And so this is really just put the samples onto the auto sampler, go away, let the system do the work, and come back and find it ready to be processed in TraceFinder software, which can look like that. So we see all the components here, we see all the samples, we measure it, we get the extracted ion chromatogram, for example, to see the quantitative peak here, and then we get the confirmation steps. Of course, one confirmation step is the retention time here, clearly, but we can look into the isotopic pattern of the parent peak that comes for free with full-scan analysis. And since we know the elemental composition, it's easy to do a comparison of the theoretical and the practical spectra. We can look for fragments. The library contains up to 5 fragments per component, which comes with the software, so you have the fragment information. You just need to click it on and it will do it for you. And of course, we have the calibration curve, so linearity is given. So this is a check mark. This component is detected and confirmed. Go for it, report it. Just a couple of examples. Ampicillin, cephalonium from the antibiotics range, dimetridazole, metronidazole from the nitroimidazole range, just to give 2 different types of components here, which still perfect linearity here. We cover a range of 5 orders of magnitude here. We can do up to 6 orders of magnitude on the instrument. But as I said, what you can do as well is a subsequent screening. It can be a targeted screening just with a big list, but you can do unknown screening as well. Matter of time is that I stop here at the targeted screening, where I will show you what I did here. So I just applied a big list. It contains 2,000 components. And here I looked into the isotopic pattern, I looked into the fragment ions, and I looked into the library. As I said, we have this newly created library, so this is the base which I was working on, and just running it through the samples here. And this is just one example. Nicotinamide I picked here from the components I detected additionally. And as you can see again, we have an isotopic pattern match of 100%, 4 fragments were searched for, 4 fragments were found, and the library as well gave a hit. Basically, I don't know the number here, but it must be greater than 80%. That was the limit here. So just to show it a little bit in detail, extracted ion chromatogram, we have the isotopic pattern match. You can see the overlay, easily quality control that it really matches well. And the fragment search result, you see the fragments, how well they match in intensity and mass accuracy for all your components. So one generic method serves for all components. It is easy to set up and operate, no optimization needed. We have the integrated software doing all the data processing for you, so you just can set up the samples, go away, and find in the end the printed report if you want. And with variable DIA, we are sensitive, selective, and we can do retrospective analysis on it. Another example were pesticides in bead metrics in this case, run again, of course, on the Q Exactive Focus, this time with data-dependent MS2. And again, the library was used for confirmation as well. These are the components we looked at in this case. So a couple of pesticides here in the food matrix. And if you look into the LODs here, LOQs here, it's all around 1 ppm with only few exceptions. But look at the regulations here, where the limits are. We have 50, we have 100 ppb. We are fairly below, so that's really future safe, even if the regulations get tighter. Linearity, in all cases, very good here. So no question that this is a valid quantitative approach, which you can use for routine analysis very nicely. Again, of course, automatic processing, you get this traffic light system here to see if all your criteria have been matched. You see again the quantitative peaks, you see the fragments, and here we have an example for the library screen where this component in this case has been found with a score of 91%. TraceFinder offers you a lot of quality criteria which will flag immediately if a criterion like linearity is not met or something like that. You get an easy overview over your data. You don't need to look into everything, which can be very tedious with hundreds of components and hundreds of samples. Another example for the library screen, that's what it looks like. So you have, with one click, easy access to that if you want, really to prove that the match is what you expect it to be, and that this is not sort of a one-hit wonder on some random spikes. Okay, so with full-scan data-dependent MS2, you can meet all the detection limits of EU regulations. You can confirm very nicely using the new Spectral library, and the Q Focus can do all that easily. So we had an early user of that. That's Hans Mold from the Rickelt Institute in Wageningen. And he said, I consider the Q Exactive Focus as a fit-for-purpose alternative for pesticide residue analysis currently done using triple quadrupole instruments. Besides equivalent quantitative data for frequently detected components, the instrument provides a complementary screen of many other components from the same injection on one instrument. And this comes from his comparison with as well competitors' instruments being high-res, being triple quad, and our own Q Exactive family instruments he has as well, and the Q Exactive Focus does as well in terms of selectivity and sensitivity as the other Q Exactive instruments do, and it is equally or better than the other instruments he has in-house. Of course, we don't run only food safety or environmental applications. We look into clinical applications as well, for example. So we have the targeted screening in urine using full-scan data-dependent MS2, in this case with permanent polarity switching. So we have a full scan on high resolution, a data-dependent MS2 on low resolution, switching the polarity, doing the same on negative polarity and back. So what are the results are looking like? We have 300 components, positively and negatively ionized. We have components spiked in some sort of real-life samples and analyzed here from the real-life samples from a collaborator. So that's not only made up, this is a real sample. What does it look like if we look into the results? So for fentanyl, for example, we can easily match the MLVZ accuracy, extract that as in the other examples as well with 5 ppm mass accuracy. We have the retention time, we have the isotopic pattern which matches well, and we can apply the library search. So an easy confirmation here. I said already the toxicology library, I mentioned that already, and starts to repeat, as you can see. We again use TraceFinder, we again use the same criteria. It's a different field of application, but the way you run it is the same. And you have the easy steps of confirmation here. So we have the library match again, we have the isotopic pattern match again. But looking into these donor samples, which are real life, easy to detect phenobarbital, fentanyl, norfentanyl, and you see here, that's the point I want to draw you to. This is the number of scans across the peak with polarity switching on such an application. It's not 1 second peak, but it's not a really wide peak, and still we get lots of lots of quantitative scans here, and lots of confirmatory scans as well, which you can rely on for fragment confirmation. And the second sample even contained a couple more, so I don't show the scans across the peak, but we get nice peaks here. They are not somehow edgy because they only contain 2 scans or something like that. So we get really the nice peak shape because we get enough scans across the peak despite the polarity switching. Okay, what we can do as well is quantitative analysis of opiates in urine. In this case, we are using the PRM mode. So this is a targeted MS2 mode. We have an inclusion list with the precursors. All precursors will be fragmented. All the quantitative, qualitative processing in the end, of course, works on the fragment side. So it should be the most specific method, collection of high-resolution MS spectra for each analyte and the internal standards. This is what such a method looks like. We have an inclusion list with certain parameters like the retention time, like the collision energy, like the polarity, in this case only positive, but we could do it negatively as well. It's an easy setup. You don't have to think about many parameters here. And so we have a wide calibration range, 2 to 5,000 nanogram per milliliter, a couple of QC samples. And this is what it looks like in the end. For example, the Oxymorphone. You get a very nice peak on the quantifying ion, and you get enough qualifier ions for confirmation. So again, whatever the regulatory needs are, you can meet them because it's all high resolution detected. If you're in need of some identification points, this always gives you enough identification points. And since we are not selecting the fragments in a Q3 like on a triple quad, we see always all fragments. So you even could use more fragments if you want. These are only the most abundant fragments for confirmation here. Again, let's look into the scan speed of the instrument in that case. You see again, we get more than enough scans across the peak. for quantitation, so no worries that you need to quantitate on a 3-peak representation. That's really enough that you get good peak shape and a reliable peak area. Of course, we want to see that the instrument behaves linear the same way, even in that matrix, but you see no problem here. It's perfectly linear. And what we have as well, of course, valid for the other applications as well, but not yet mentioned, that is that we can use, that we of course can apply ion ratios. This is automatically done by TraceFinder as well. TraceFinder even can derive the ion ratios from a high concentrated standard. It's a one-click application for you to say, okay, just look into this standard file and get the ion ratios from there and apply it to the rest of the analysis. So that's easily done. You don't need to put it in. If you're dealing with 500 components, it could be very tedious. TraceFinder does that for you. So looking into the sensitivity of this approach here, so you see LRQ is 2.5 to ppb, and knowing, especially in drug analysis, what the active concentrations are you need to have an effect, we are way below of the active concentrations. So no problem to detect everything you need. So, and one of the customers using the new Q Exactive Focus, that's Martin Hornshaw. You can see his quote here, but I would like to invite him to come up here and give you a couple of words on his first experience on the instruments he had during the last 2 months.
So I have this instrument only for a couple of months, and I didn't have time to produce data yet to present here today. But I still work with Q Exactive and Exactive Plus instruments. And as I said this morning, I invite you to consider this kind of technology, high resolution for your routine analysis. I'm pushing that for the last few years already. I think with this instrument, this is a kind of silent revolution. On one point, the price, I think, I don't know exactly the price, but I think what they told me, this is the same price in the triple quad, right? So the next purchase, I think you should consider to do a comparison side by side with triple quads and this type of instruments, and then look the data, as I did 3 years ago with the first Exactive instruments generation. I just compare triple quad data and Exactive Plus, Exactive instrument at that time, and I realized that was really comparable. So I just invite you to actually send your samples to these application specialists, and then make your mind, of course, with your own analysis and own demands. So I don't remember what I said, but basically, I think this is a trend, as I said this morning, a trend where MS makers will push for high resolution, especially if, as customers, we are asking for it. That's also a point. The vendors are looking for what we need, but if we don't move, they will not move. So I think they understood that more and more people are pushing for that, and of course, they have to follow us, right? So that's only what I can say today. If you have questions, you can ask me or other specialists in the field performing routine analysis, whatever clinical or food safety, and I think you will see that they all think the same.
Many thanks, Bertrand, to come up rather spontaneously and give us a little introduction, little overview or impression of what you did so far with that instrument. Okay, so in total, in the end, we have, as you can see, a nice little universe around Q Exactive instruments. And of course, the Q Exactive Focus is an integrative part of that one, of that universe. The software we are mainly dealing on with this instrument is TraceFinder software. We have lots of examples. We saw lots of examples from TraceFinder. We have just released yesterday, newly released together with this instrument, our new ToxFinder software. Some of you may have heard about ToxID, which was long time our simple to use software just for screening results, quick overview. And ToxFinder is the successor of that. In the background, it's based on TraceFinder, but much more simplified. It's for screening and relative quant. It's not for absolute quant, but very easy to use, very quick to use, with the same databases in the background for the same way of confirming your results. So, as the concluding remark, so this is the portfolio we have on the Q Exactive family. You see it's growing bigger and bigger with time. We have the Exactive Plus EMR, which is sort of still the entrance instrument. We have the Q Exactive and Q Exactive Plus as our so far working horses. We have the Q Exactive HF as the top tier instrument with the best performance of all. And as I said already, so far the development has always been up, and of course up in price as well. The Q Exactive Focus is the first one to go down from a certain point. And when we say always affordable, durable, proven, about durable and proven, I think I've given you some examples here. The affordability we left out so far here. And of course, this is not the place to give you numbers, but I can tell you the next time you're thinking about buying a new LC-MS system in your lab or a high-resolution instrument, namely a QTOF instrument, you should consider this one. It definitely will fit into the budget you will need for the other types of instruments as well. So we are a little bit advanced in time already, so I don't want to go over this really in detail, just an overview what can the different instruments do. So as a conclusion, from my side, why should you buy now a Q Exactive Focus? So you have higher performance analysis in the most affordable Orbitrap ever, refined for routine laboratory experiments. So the performance you need, the software you need for processing it. You can use it for routine qualitative and quantitative work with optional retrospective analysis, 2 techniques on 1 platform. So you can do whatever you want to do in a triple quad and you get something extra for the same price. It's easy to use. Most method setup on an instrument like this is without any evaluation, optimization. You just go and shoot. You have versatile processing software. TraceFinder and ToxFinder are only 2 examples of the software portfolio we have for this instrument. If you need more sophisticated software, ask us. We have more sophisticated software. And we have user-friendly daily operation. This instrument is really designed for 24/7 operation in high throughput. Okay, and so far, I thank you for your attention, and maybe you have some questions for us.
So if there are no questions, I guess I'll remind everybody that you have a short break now before the next session. So there's plenty of time for a coffee. Haroon, you have a question?
You touched a little bit on some of the antibiotic assays. Do you have software
For which assays?
antibiotics? You showed measurement of some of the antibiotics,
Yeah,
and the linearity looks very good.
yeah.
So following on from that, it should be possible to convert these into very sensitive wrapping assays that
Uh-huh.
in the hospital. Is this something you plan to do, or is that developed?
I don't know that we're going to commercialize assays for antibiotics, but I don't know that we will or won't, is the honest answer. But this...
Of huge interest, of course.
Yes, for microbiology, absolutely. So the software you have right now, the TraceFinder, will actually operate the instrument and will actually acquire the data, will process the data, and generate a standard format of report. So you kind of have a multiplexed assay already. But if you mean are we going to sell kits and so on, I don't know the answer.
No, the drawback was always the fact of the quantitative aspect, and therefore it was done on a triple quad.
Yes.
And now it is
So we saw Bertrand show in one of his slides earlier today, the first publications came out, I think, 2008 with Exactive products. So there's quite a long history now showing that the metrics of a quantitative assay on these types of instruments are more or less exactly the same as the performance metrics on triple quadrupoles. In some instances, they're better. And it's compound specific. Sometimes a triple is better on a compound. Sometimes high-res approach is better on a compound. But on average, over a wide range of compounds, they're almost identical. Okay, I'm going to get a coffee.